But welcome. Thank you so much for your patience. I appreciate it. Again, my name is Marguerite Pierce. I'm COO and co-founder of She Matters. My partner, Jade Kearney, is also co-founder and she is CEO. She sends her regrets for not being able to join us this evening. She has a sick child, but she is here with us in spirit. So since we're already 10 minutes after, we will get right in, and I'll just go over again the setup for those of you who are just joining us. But I'm going to give each of these lovely mothers 5 to 7 minutes to share their experience, their childbirth and or postpartum experience with the U.S. healthcare system and their providers, and then I will open it up to the attendees to ask any questions. If you have a question that's specific to one of these moms, please put their name in the question so I can direct it accordingly. Otherwise, I will ask each mom to answer. Any questions that anybody has, please put them in the Q&A box, and we can go from there, or raise your hand and then I can acknowledge you that way. Okay, mamas, I'm just going to go in the order that I see you on my screen. So as I call your name, please feel free to give a brief introduction about yourself, where you are, like what city and state you're in, and how many children you have, and then you can get into sharing your experience. How does that sound? Good. Okay, Gayle, you're lucky number one. So you have the floor.
Of course. Hi, my name is Gayle Geeter. I live in Nashville, Tennessee. My story of labor and delivery spans over 3 states. I have 2 children, 8 and 4. And to get started, I found out I was pregnant with my daughter on January 23rd, 2014. Very much wanted, my husband was in the military at the time. And just for the sake of time, I'm gonna take you through the highlights or low lights. I had really severe morning sickness. I'm not a big woman, but I had some early concerns because I was losing weight instead of gaining weight. We shortly after finding out I was pregnant, my husband found out he was deploying. So we had to not only navigate this new normal of pregnancy, but also transitioning into parenthood with him being in a time zone that was 12 hours ahead of my own. At 28 weeks, I don't know if if anyone's familiar with the military, but they go to the field a lot. And when you are scheduled to deploy, you do even more field exercises to prepare for that deployment. And so at 28 weeks, I was in El Paso, Texas, and he left on a Tuesday, and on a Thursday, I was experiencing preterm labor. And so I had to be rushed to the hospital. I had already had about 5 ER visits up until this point. And so I got to the hospital, and I remember the doctor coming in very frankly saying, like, your husband may want to get back here. And so they were going to helicopter him in from California. It was so much drama. It was not drama, but long story short, they were able to stop the contractions. So I was able to carry to term, but my pregnancy was not without crises after crises when it came to preterm labor. And even though I had preterm labor, I ended up being induced because I went 9 days past my due date. And with that induction, I wasn't as informed about what they were doing. And I don't think that the effort was made to make sure that I was as informed. So I had 2 methods of induction: the balloon, if you're familiar with the balloon, and Pitocin. So what that meant for me and my body is that for the next 30 hours, I would experience contractions every 90 seconds to 2 minutes. In the beginning, I didn't have an epidural. They gave me a medicine that just made me extremely sleepy to where I just slept through the pain. But it got to the point where it was not really bearable. And so what happened was they gave me, I had 3 epidurals in the 30-hour labor period. I had what they call hot spots, so I could feel it. I was very aware. I really could have walked if I'd wanted to. I ended up having an emergency C-section. We went in at 3 o'clock on October 16th. My daughter was born at 3:30. They never went to get my husband. And so while we're in the OR, they say like, okay, Mr. Geeter, we're gonna come back to get you. They rush me. While I'm in there, I'm struggling to breathe. And so the anesthesiologist is standing to my left, and I take the mask off my face and I say, hey, like I can't breathe, something's wrong. And he puts the mask back on my face and says, your baby needs oxygen. And I say to him, I don't think you understand. Nobody's getting oxygen because I cannot breathe. And he just puts the mask back on my face. But this is after the third epidural, where come to find out they did it a little too hot. And so I went numb, but I was still very aware and was like, wow, my husband's about to deploy in 2 months and I am not about to make it off this table. And so I woke up 3 hours later, get back to, I spend that time in recovery. They had fed my daughter formula because they didn't inform my husband of what our wishes, like what my concerns were, and he didn't really have the tools to really navigate that. I ended up suffering from postpartum depression. I ended up ripping my C-section scars, and I really had PTSD around childbirth. And so during the deployment, I obviously didn't have to worry about anything, but I ended up with the Nexplanon. But once I got the Nexplanon removed and thought, okay, I am ready for the next kid, I took my Nexplanon out February 8th, March 7th, I was pregnant in 2018. And so I was living in North Carolina. I'm trying to hurry up for the sake of time so everyone has enough time. I left North Carolina when I was 26 weeks pregnant and moved to Nashville. When I got to Nashville, I did not see a doctor until I was 36 weeks pregnant because they just didn't have, everybody was pregnant in Nashville at that time, I guess. And so early in my pregnancy with my son, I was like, I don't know if I could do this again. I was terrified. I was like, I don't know if I'm gonna make it. I had found out I couldn't give, I didn't have a doctor here who would support a VBAC or a vaginal birth because I'd had a C-section. And so I had to, in Tennessee, you have to sign a paper when you want to be sterilized. And that paper has to be on file for 30 days. But my C-section was scheduled 29 days after I signed that paper. And so my son was born in November. I had to go back in February to get a bilateral tubal ligation. And in March, during spring break, I had an infection spread where my doctor was like, I have an appointment about 8 days from now. But I was like, I don't think I'm gonna make it 8 days because something's wrong. I'm 5 weeks post-op and I am 5 months postpartum. And I went to urgent care. I went to the emergency room, and I ended up having to see a nonprofit, like reproductive rights organization to help me. And they told me to go back to the ER to show them my screenings because I had an infection spread from like just normal regular bacteria met the bacteria from my bilateral tubal ligation. And I made it, but you know, that's my story.
No, thank you so much, Gayle. Thank you for sharing. And we're glad that you made it through. ZuShanna, you're up.
Woo. I'm just gonna say woo. Unfortunately, I had many similar experiences. I am ZuShanna. I'm from Brooklyn. I'm a mom of 3. Uh, with my first birth, I was 35, which is considered advanced maternal age. And I sought out a provider that I trusted. She was a Black female OBGYN. During my time seeing her as a first-time mom, I said, hey, what are the different birthing methods I should try out? Bradley method, XYZ. She said, we'll talk about it. We never talked about it. A week before I was due, she joked that she hoped I went into labor because she had a conference the week that I was due. On my due date, I went in to see her. Everything was fine. Everything was normal. My blood pressure was elevated because I had had a stressful incident on the way, like driving on the way. She let me stay for an hour. My blood pressure returned to normal. I was on my way home. She called me to say I should go to the hospital to get checked, even though my blood pressure went back to normal. And I explained to her what had happened on the way. I get to the hospital, they made me wait for hours, which was stressful. So when they saw me again, my blood pressure was elevated. They said they needed to admit me immediately. Um, Hours later, she called in an induction. She didn't speak to me, didn't tell me, didn't inform me what it was. The nurse there pretty much encouraged me to delay the induction, go for a walk, take a long shower, but I had no idea what was going on. They induced me with Pitocin. I was on Pitocin for over 24 hours without an epidural. When my OBGYN finally came in, she recommended a C-section, said they were worried about preeclampsia. I originally said no. She had another OBGYN that I trusted, I knew personally, come in and recommended as well. And so I agreed. There were some procedures, some unnecessary procedures that happened during that time. Similarly, the Foley balloon, breaking my water, different things like that. None of it helped me progress. And so they recommended the C-section. As they were putting in the epidural for the C-section, I felt fire in my hip. And all they said was, don't move. And I literally said, I felt fire in my hip. And they were like, don't move. They stuck me at least 10 times. I literally had tracks down my back for over a year. I couldn't walk more than a block for over a year after I gave birth to my son. During the C-section, I could feel everything. And when they did the original test, my OBGYN said, can you feel this? And I told her yes. And she was like, what do you mean you can feel it? Can you feel pain? Can you feel sharpness? And I was like, I can feel exactly what you're doing. You're in this section, you're doing this. She told the anesthesiologist to give me more. My husband heard the anesthesiologist tell her that she'd given me everything she could get. And so our belief is that the epidural was not in properly. They proceeded with the C-section. They kept my son away from me from over 12 hours, even though he scored high on the APGAR test and I was completely conscious and fine. I also wasn't able to breastfeed. I was producing colostrum, but a pediatrician claimed that he'd lost weight. It was 0.08%, but she made it sound like it was dire. The lactation consultant recommended that I breastfeed. The pediatrician recommended I give formula. Once he got formula, he was not able to breastfeed. I also suffered from PTSD and postpartum depression. Didn't realize until way after. With my second son, it was a fight to find a provider who would help me have a VBAC. And they did not inform me of this when they recommended the C-section, that there was a possibility that I couldn't have vaginal birth. I had one midwife that I consulted with tell me that I was fat, Black, and old, put my information in a VBAC calculator and inform me that I have 15% chance. I went to another provider who said that there would be no midwife that would help support me in a VBAC. She was an OBGYN. I finally found a midwife who was willing to, I found a couple that were willing to support me. One was in a hospital in New York where my husband wouldn't be able to be there because it was a Jewish hospital. And I ended up going with a different midwife. That midwife agreed, reviewed my records, said I looked like I was a good candidate. She thought that my OBGYN failed to wait. It was failure on their part to wait. A month before my due date, she informed me that she was not going to be available for my birth. My birth due date was on Thanksgiving. And so in October, she informed me she wasn't going to be available. Her backup had originally not wanted to service me because I was overweight, even though I had no health issues. Her backup ended up being a bully, violated my rights, made me get another epidural, even though I said I didn't want one. Lied to me and said if I signed myself out that I wouldn't be able to return to the hospital to give birth. Literally told me that her daughter had had 3 C-sections and some people were not meant to give birth. Thankfully, an OBGYN on call walked in the room and informed me. She was like, do you want to, the midwife eventually, so it was the similar thing. They had to induce me and it was on my due date. I was contracting, I had lost my mucus plug, but when I got to the hospital, I wasn't progressing. I was progressing and I was going to the bathroom every few minutes. The midwife made me stay in bed and strap me down to the monitor, even though I was progressing with having to go to the bathroom, and the nurse said she was willing to help me. Once I stayed in the bed, I stopped progressing. And so after about 12 hours, the midwife told me that I needed to call it. I needed to throw in the towel. A random OBGYN that was on call walked in the room and was like, "Do you want a C-section?" And I couldn't speak. I was in so much pain. I'd been induced with Pitocin as well. Um, Also got an epidural then, but the epidural did not work. I felt everything. My husband and my best friend said no for me. And the OBGYN informed the room that it was my right to labor. Within 4 hours, I went from 4 centimeters to 10, and I delivered my son with one push. And then with my daughter, I hired a midwife, a home birth midwife. Unfortunately, I was 3 weeks post due and the pandemic was looming. And so my midwife suggested that I go into the hospital to be induced. Thankfully, the midwives at that hospital were respectful of my wishes. They did induce me with Pitocin. They did do the Foley balloon. They did break my water, but they spoke to us. They asked us questions. They informed us. My husband had a question about the Foley catheter, and the midwife literally stopped what she was doing, and she's like, "Oh, do you want to see it?" She took a new one out. She showed him. She explained how it worked. This was my third induction, and this was the first time this was being explained to me. Um, it was just a completely different experience. And so I had 3 hospital births with three very different experiences. Thankfully, my midwife went with me to my third birth and advocated for me. And 90% of my wishes were respected. Like I didn't want the induction. I didn't want, thankfully I did it without an epidural as well. And similar to my son, I pushed my daughter out with what I felt was 2 pushes, what my midwife will tell people is 1 push.
Thank you so much, ZuShanna, for walking us through that. I know it's difficult to relive. LaTanya.
Can you guys hear me?
Yes.
Okay, I was just making sure I was unmuted. Hi, you guys. My name is LaTanya. I'm based out of Orlando, Florida, but I'm originally from Kentucky, Elizabethtown, Kentucky. I have 3 children. All of them were C-sections, and what made mine a little bit stressful was the fact that they were all back to back. So all of them are 3, 4, and 5. I had a very unusual experience because I originally worked in healthcare before. So I thought that me being educated in that actual like workspace, understanding the practice and understanding my rights would protect me as a mother going through birth. And the crazy thing was the same job and everything that I got to support my children became the reason why I was not able to support my children. I ended up, I want to say 12 weeks, 13 weeks, I found that I had O negative blood or O positive blood, sorry, and you have to get the RH negative shot. I kept telling my doctor, I had Ms. Poston, which was originally through my healthcare insurance through my job. So I felt like me having provider insurance through my actual employer would provide me with better care in the workplace, well, inside the hospital setting, just because my experience from working in it, I'd seen a lot of mothers kind of get passed by or neglected because of the type of insurance that they had. And that's coming from working in the ER. So when mothers come in and they're having miscarriages and things like that, that's the kind of fear and stress they would come in and then be denied care that they truly deserve, regardless of what insurance they have. So fast forward, I'm pregnant, I'm 13 weeks. I'm basically miscarrying at the time. They give me an RH negative shot. They're at the time, they're very educating with me. Like they would give me tips, tools, tell me everything about pregnancy. So I was actually getting excellent care at the beginning. I was able to go to a specialist because they told me at the time that I was pre-eclamptic. And I didn't find that out actually until about 4 months into the pregnancy. And I found out when I actually was going to have to deliver my child. They found out, I want to say maybe closer to her being delivered, because whenever I was getting seen and I was losing weight, she was losing weight as well. And the providers were not listening to me when I was letting them know, hey, something's wrong. I've never had an issue with blood pressure, but because of my ethnicity, a lot of the times they would say, oh, well, it's kind of common for most Black women to have high blood pressure during pregnancy. And I was like, I'm not sure, because based off of just my medical, which is what I felt like was also another concern, was being seen as a Black woman instead of just being seen as a patient. A lot of the times when I would voice concerns, they would chalk it up to like a racial thing or a societal thing. And I was having true concerns that had to do with my child. So then I want to say 4 months pregnant, I went to see the specialist, which was it was the neonatal specialist, because I was going 2 to 3 times out the week to be seen. They would do blood pressure checks and things like that. And no one would give me an answer to what was wrong. They would just kept telling me that something was wrong with what I was doing. Finally, on one of my last appointments, they went to get blood pressure checks. They kept telling me they couldn't find her heartbeat. And they finally admitted me in. They wouldn't tell me what was going on still. They kept telling me like, you're just going to have to be monitored for the next. They wouldn't even tell me to the extent of like, hey, we are concerned that we are going to have to do a C-section. All the way up until this time, I'm thinking I'm just going to get seen, do a natural birth, because that was what I was wanting to do. And that was what was discussed with my with my OBGYN. I get admitted, I sit in the hospital for 2 weeks. And after 2 weeks, they rush into the room. They tell me that they can't find a heartbeat. And they tell me that I'm going to have an emergency C-section. Whenever they did the emergency C-section, it happened in a matter of like 20 minutes. No one was formally educated. Their father was out the room, and every time they would like communicate anything that was going on with me or the child, they would do it whenever he would step out the room. They never did it when he was in the room. And so we ended up having Anaya February 21st when she was supposed to be due February 29th. And she was in the NICU for 4 months. Even with that, I realized that the post-care, like whenever she was born, I was not able to see my child just like the other mother was speaking on. I did not get to bond with my child, I want to say up to 3 days. 3 days after having her, I was finally able to hold my child and see my child. And then whenever they had me in the room, they weren't actually worried about my care of like what was going on with me actually healing. I was already experiencing a lot of postpartum depression side effects like while I was there. And all of that was ignored. So fast forward, they never really necessarily tell me that I have to be concerned about like having a C-section in the future. They just let me know like if I was to have them back to back, I would have that issue. But they told me that I should have no issues with future pregnancies. Fast forward, I have my next child, which she's born at normal birth weight, and I lack the care of, now I lost my job, so I'm on Medicaid. And so when I was receiving Medicaid, they weren't as, I guess, I want to say they weren't as in tune with my pregnancy or actually cared. I didn't feel like they cared about my pregnancy as they did when I had insurance through my employer, just because the amount of times I went to go see the provider completely decreased, even though I just had a child not even like 13 months ago. So you would think that me having one C-section and then being pre-eclamptic in that one, well, considered pre-eclamptic in that one, that I would have some type of like education or a little bit more concern into the second pregnancy. Second pregnancy, I start losing weight. I go through basically the same symptoms of preeclampsia, but they don't diagnose me with that. But I still end up having a C-section. During that C-section, I went through the same issue that another mom went through with the epidural. Whenever I went to get the epidural in my back, originally, whenever they had the first person put it, it was an actual student, and it wasn't the anesthesiologist, and they didn't get my permission, which I found out later on that they are supposed to get your permission if they were to allow a student to practice on you. And the student messed up 3 times. I had a line of epidural dots up my back, and like she said, they did not go away. I felt back pain that I never had before pregnancy. Even during my pregnancy, I didn't actually have any back pain. It was after the epidural and the situation with the 3 epidurals that I started having more physical problems that I never had before. Fast forward, I moved to Florida. I had my last child in 2019, 7/29. And that one, I seen there was a transition in care from Kentucky to Florida, to where here it's more of get them in, get them out. It's not really the concern of any mothers. I wouldn't say that's a race thing or like any like a societal thing. I feel like honestly, for any of the moms that's coming in there, it's get in, get out. They're not really educating you on the care. I had my child, they let me keep all 3 children inside of my room while I'm healing from the C-section during the entire time. And I was released not even, I think 2 days after I had my C-section, I was out at home with my kids, and I was having issues with my uterus not going back into position. And even the aftercare, I think I may be seeing the provider once or twice, and that was after I got the sterilization, which I wasn't informed too much about as well. So my experience has been kind of like odd, but I would say that a lot of times I did not feel heard. And even now, my mental health was never addressed. I noticed that no matter what, my income didn't matter about what type of care I was going to receive. And I also realized that like our actual body, like the health of us, we're not like even concerned after we have the children. It's kind of like once you're done, that's it. So that was my experience.
Thank you so much for sharing, LaTanya. I appreciate it. Last but not least, Michaela.
Good evening, everyone. My name is Michaela Smith. I'm here in Madison, Wisconsin. A little bit about me. I have 10 years of birth work and reproductive justice and racial equity background. And the reason why I'm sharing this with you is because I'm not from Madison, but I moved here specifically to work in birth work. And so I'm really affiliated with the hospitals and the clinics here in Dane County where I live. My doula agency in 2016 were the first doulas to actually be able to be a part of the hospital and be paid by the hospital system. Currently, I manage a program called Connect RX where it matches Black families to Black doulas and Black community health workers. So that's my profession. My profession did not save me from my experience as a mom. I am a proud mom of two little ones. I am 4 months postpartum, so I have a 4-month-old and I have a almost 2-year-old. And I am also advanced maternal age. And so I knew all of these facts going into both of my pregnancies. And ironically, in 2020, right before I got pregnant with my daughter, I led a march specifically on what was going on in 2020, just racially to us as a Black community, not only with COVID showing the disparities, but also, George Floyd. I live in Wisconsin, so that's just right next door. And then him calling out for his mom in his last breaths. And so that was what we marched on. And I say this because I spoke. My husband spoke at the hospital that I gave birth at. And so fast forward to my my pregnancy with my daughter, I had a provider just wanted to like ask me questions about the march or ask me questions about my profession instead of really caring about my care, caring about the fact that this was my first viable pregnancy. I had just had a miscarriage. And so I had a lot of anxiety on making sure that this pregnancy would go to the end. And that's what I wanted to talk about, but she wanted to talk about inappropriate things. And so I was able to fire her and moved outside of the, I'm under SSM clinic. So outside of an SSM clinic into a private care that my insurance provided. And so I went to this more holistic provider, and I knew in Dane County, I wasn't going to be able to find a midwife that was going to take me just with the fact that I was advanced maternal age. I'm labeled overweight, I'm Black. And so my next best thing was a family medicine doctor. And I knew that this specific family medicine doctor really believed in vaginal births. And here in Dane County, we are known for our C-sections. And so that was another fear I had being 35. I'm like, I don't want to do a C-section. I don't want to do that. I've supported those unnecessary C-sections. I want a vaginal birth. My first experience with my daughter. That birth was beautiful. I had two nurse midwives, and just, had a really beautiful experience. And so when I got pregnant with my son, I was expecting the same. I had the support of my wonderful doctor out throughout my pregnancy. Both pregnancies, I always developed hypertension, gestational hypertension. So of course I'm observed a lot more often. And that's, just, I'm used to that. And so my doctor would always make sure that I wasn't getting preeclampsia. And so I was constantly getting blood work, urine work, all of the other things. And I would always stay stable. And I become anemic in pregnancy as well. So dealing with gestational hypertension and anemia, making sure everything's going well. So I also see maternal fetal medicine because of that, because of my high risk stage. So I'm in and out of the clinics and in and out of this hospital that I'm going to be giving birth at, that I also manage a program at all the time. So I was induced for both of my pregnancies. So I know how they go. I always get induced at 39 weeks and 4 days. But with my son, I started feeling different at 38 weeks. I kept feeling like something wasn't right. And I knew my body, I was in tune to my body a lot more with this pregnancy because it was my third time around. And so I went into the hospital and I really felt like I was supposed to birth him that day. I just really felt that, but I was dismissed. And I can't tell you or remember exactly what this resident said to me. All I know is that I asked him to not come back and to send someone else that I could speak to because I felt that he wasn't listening to me. And I also felt kind of the creep vibes from him. And I shared that with my husband. And so he advocated for me, and my doula was there. She advocated for me. And I told my doctor my next appointment, and she ensured that he would never, no matter if I had another pregnancy or any reason, that I would never have to talk to this particular resident again. But I was still disappointed that I was sent home because I really felt that I was supposed to give birth that day. And so I'm at home and I'm laboring for what felt like 2 weeks. Then my induction date comes, and I go in for my son, and I really wanted to try to not have an epidural. I had an epidural with my daughter, and I remember I had this nurse come in and tell me, stop pushing. She could tell on the monitor that I was pushing with my daughter. And I'm like, I have an epidural and and I'm being induced, like, I can't feel anything down there. So it's my body saying I need to push, I can't control that. And she's like, you need to stop pushing. You need to stop pushing. I was like, well, then tell my body, because it's not me. It's my body preparing for my child. And then I remember she didn't ever return. But like I said, my daughter's birth was really beautiful. But my son's birth, unfortunately, my blood sugars dropped and my blood pressure rose up. And my son's heartbeat rate was getting lower. And so there was a lot of people that rushed in the room at once. And this woman just kept coming at me with her fingers like this, right? So obviously she wanted to check me. And I was like, what are you doing? And she's like, I got to check you. I got to check you. It's an emergency situation. I said, no, on the board, it says the only person who's checking me is either my husband, because he was taught by my doctor, or my doctor. You are not touching me. And she's like, I don't care what your wishes are right now. This is an emergency situation. And I said, no, you're not going to touch me. I can wait for my doctor who is on her way in, or my husband can do it, but you're not going to be touching me. And she almost got to me to touch me. And my husband literally physically pushed her away from me. And my doula stood in front of him, because he's a Black man, to ensure that they didn't kick him out, to be like, you need to listen to what she says. She does not want to be touched. And so I asked for that woman to be removed. And they're like, well, she needs to learn. She's a resident. She needs to learn. I was like, I don't care what she needs to learn. She needs to be removed out of this room, because I don't feel safe with her in here. I don't know if she was removed, because after that, it was a whirlwind. They figured out that my son had his cord wrapped around his neck. So I was given a 30-minute window to push him out. And if I didn't push him out in 30 minutes, then I was going to have to give a C-section. And so they did use the balloon, or not the balloon, I'm sorry, the vacuum to get him out. And luckily I pushed him out before the 30 minutes ended. And so when he came out, he was, floppy and not breathing. And so they wanted to rush him out. And I said, skin to skin is best. So anything you need to do with him, you can do it on my body. And they wanted to fight me on that. And I'm like, well, we got seconds, we don't have minutes to spare. So that they still took him away from me and got him, resuscitated him. And then it was about 15 and 20 minutes before I got him back on me. And they kept saying, you only have 5 minutes with him. You can only have 5 minutes with him. And I didn't know what that meant. I didn't know if that's all he had. I didn't know. Nobody was explaining anything to me. And at the same time, this resident is trying to pull on my placenta. And my doula was like, whoa, why are you pulling on her placenta? And I had asked for no residents. This is a hospital that I am a partner to. And I know all the right words and all the right jargon to say to get your wish. And yet no one respected anything that I asked for. And due to the fact that I was having really high blood pressures, I was diagnosed with preeclampsia during labor. And so as you women know, when you are preeclampsia after labor, you're on magnesium for 36 hours. And the crazy part about the magnesium is that they also have to keep, for those of you who are listening in, you have to get your blood drawn almost every 2 hours, if not every hour. And I have very small veins. And so, I was very specific about which needle I needed to have used. And I was argued with that. I also told them not to give my son formula. I already had colostrum pumped. And I gave it to my doula to give to his nurse. My husband said they didn't even use my colostrum. They used the donor milk because that's the huge thing here. That's what separates our hospitals apart from other hospitals, is we use donor milk. But I didn't need donor milk. I had my own colostrum. I was told that I wasn't able to see my son because I was a mag mom. They kept calling me a mag mom, magnesium mom, and my son was in the NICU at the time, and that I just needed to stay in the bed and just, work on healing. And I told them that I will crawl, roll, flip, whatever I need to do. But my son was going to be coming to my breast in his first 12 hours of life. And I called my husband, who was up in the NICU, and I told him what they said. And he said, I'm coming down with a wheelchair. And so my husband had to come and get me so I could see my son. And when I got to the NICU nurses were actually such a breath of fresh air. And I told them, hey, I'm the program manager for ConnectRx. And they're like, oh, you are? And, everything changed after that. All of the care changed after that. And before I had even gone in, because I knew I was having an induction, I reached out to the director of perinatal services and I said, oh, I would like this nurse again. I would like this resident to be in because I actually like that resident. I don't want any other residents in, and she had the nerve to tell me that all of our nurses and all of our residents are lovely and that I will have a great experience no matter what. And I said, okay, try me. And she tried me. And she got a very long letter. I also reached out to our local news and our local newspaper journal to drag these people and the fact that they didn't listen to me. And I'm part of the system, and so how am I supposed to safely provide these services for other mothers if you didn't even listen to me? And I'm someone who's created a professional relationship, but even in my personal relationship, you disregarded my whole human experience. Luckily, my son did well. We actually only had to stay in the hospital for 72 hours after he was born. I unfortunately had to go back to the hospital because the medicines that were given to me did not help my preeclampsia. So I was back in the hospital 2 weeks postpartum for another week. And again, I was, because I go to a clinic that's outside of the hospital system, I have to deal with the hospital doctors when I'm staying. And so the doctors there are just unresponsive, just do not care. I wouldn't be seen by any doctor, any specialist for maybe 48, 52 hours at a time. And I remember I've been in there for 5 days and I didn't know what the plan was, or, what did I need to do to be discharged? And they had still put me in the postpartum suites because I brought my son back with me since I was breastfeeding. And this nurse came in and said, we have to wake you up every hour because a mom on this floor dropped up their baby. So we got to keep waking you up. Well, of course that's gonna challenge my blood pressure if I'm not getting adequate sleep. And so I just like lost it. I cried. I lost it to the doctor. And I'm like, I haven't seen anyone for 5 days. I don't even know how to get out of here. You haven't even given me like a diet plan. Like I'm just allowed to just call downstairs and just order any old thing. And no one's been like, hey, if you eat this or if you do this, then you can probably change your numbers and get out on time. Like there was no aftercare, there was no plan. And I just felt like that was extremely irresponsible and just, what's the word I'm looking for? Um, it's like, well, I'm just set up to fail, really. Like I'm set up to just stay here because of nobody communicating with me. And then it was like I was policed with my breastfeeding and with my pumping. And, I'm like, he's not even in here. I'm the patient. He's just here because he's a newborn, and it was just a very frustrating pregnancy. And unfortunately, because of the fact that I nearly lost my life and he nearly lost his life, my husband and I decided that we weren't going to have any more kids. And there's grief in that, right? There's grief in the fact that you have to make the right decision for both your body, but also because our society and our healthcare has failed us. In order for us to remain safe, that has to be our choice.
Thank you so much for sharing that, Michaela. Those of you who are listening, please feel free to add your questions to the chat. We have one that's here already. I'll ask this. So Brianna, she's like, she's terrified that you guys experienced what you experienced, and she had unfortunately similar experiences and also suffered from postpartum depression. She's asking, how did you heal from these experiences, and how did you feel comfortable enough to have additional children, right? Like after your traumatic experience. So Gayle, I'll start with you.
So it's funny because I had wanted 3 kids, and I remember in the second pregnancy, I remember calling my husband because of course he was in a training where I was like, look, he was deployed the first time, and then he was in a 6-month training the second time. And I was like, I can't run the risk of you not being here for a 3rd pregnancy. And I was like, we're jokesters. I feel like Black folks deal with pain through humor. And I was like, look, that 3rd time, God's gonna be like, girl, you keep playing with me. And so I'm not gonna be here. And I have to think about the kids that I have. But for my son, and I always say that like this country and this medical system stole a 3rd baby from me because I would have had a 3rd kid. I always, in my mind, I think that like pregnancy wasn't the issue. Pregnancy is never the issue. We have been pregnant for forever. It's racism, it's sexism, it's lack of cultural competency, it's the removal of midwives, it's the privatization of like medical care and all of those things it's poverty, is food deserts, it's all of these things that make pregnancy dangerous for us. And so I decided to have my son because I was like, basically, I deserve to have a kid. I want a kid. I want to complete my family in a way that makes sense for me. And I unfortunately ended up not even doing it because of fear, which does the work of white supremacy. So, but I had to think like, fear, yes, may do the work of white supremacy, but me not being here and making my husband a single dad and leaving my children without a mom also does the work of white supremacy.
Thank you so much, ZuShanna. Same question for you.
I don't think I'm fully healed, to be honest. Part of what helped me was seeking out different providers and not remaining with the providers that failed me. I attended ICANN meetings. It's a C-section support group. It was 99.9% white, but these women were advocating for themselves and fighting for their right to have a vaginal birth and no longer have a C-section. And it gave me the language to advocate for myself, and then also counseling.
Thank you so much, LaTanya.
For me, I would say the first thing to do is if you're in pregnancy, go ahead and get you a therapist, because the pre-care, aftercare is all beneficial, and that start with that. Having someone building a support system. If you don't have a support system, start trying to create that for yourself. That way, when the child gets here, you have that support, the extra support that you aren't going to necessarily need. And I would say is to get out and educate yourself. There are a lot of programs like She Matters. I came a part of She Matters when I was trying to help one of my friends that is currently pregnant. And I was like, there's so many resources that weren't available back in 2016, especially whenever pre-COVID, when there's nothing virtual. There's so many things now that people can have access to where you do get the educational support, but you also do get resources that you need for your kids. Like they do the diapers, they do the formula. And also I would say for any Black women to consider getting a midwife or getting more than one opinion. If it does not align with what you actually see fit, and you also being educated and knowing your health. I feel like if it doesn't align with what you want to do, there are providers that will do it. But we're so like when you're pregnant, you're just rushing through, like everybody's rushing you through a process. You got 9 months and this is going to happen in 9 months. And it's happening in 9 months regardless. But they never actually educate you on that back end of maybe you're going to have your kid earlier. So it's like just honestly getting education, therapy, and honestly a lot of self-care. I feel like self-care is vital for any mom. That doesn't matter what race. Having a form of self-care to rely on to center yourself is what you need through pregnancy, after pregnancy, and through motherhood, honestly. So just kind of adapting some physical things, some hobbies into self-care. That was what I would say.
Thank you, LaTanya. Michaela, how did you heal? How did you, your first experience with your daughter was positive. So therefore, I'm assuming that had helped you and your husband decide to have another child. So.
Yeah. I am probably coming out of the fog of PTSD into the beginning of my healing journey. There's still moments of just utter despair, of grief, of the fact that this was my last pregnancy and that this is how it ended. But also the grief of the fact that I won't ever experience again because of my safety. A lot of what Gayle was saying, I identify with, because I want to be here for these 2 babies. I can't bring any more in. And so, at least not physically. And so I think that a lot of my healing comes from the fact that I do like to joke. My husband and I are jokesters. I have gone back to work really slowly, and that's been helpful, just because it's like I work where my trauma happened, so I have to be really mindful of that. I've been in therapy since I was 15, so it's that I actually had to find a new therapist who specialized in maternal mental health because realizing that that's a whole different type of therapy, and that having that specialty, having a therapist with that specialty has just been so nice, because there's just times where it's like I don't have the words, but she's able to do other things with me. But and also just holding my babies, like when we talk about dismantling white supremacy, it's like holding my babies and doing what's best for us, irregardless of what is told or what a sleep trainer tells you to do. That's also therapeutic. And it's also like reparations, and the fact that as a black family, we can do what is best for our Black children.
I love that so much. We have a couple of questions. I know we're right at 8 o'clock, but if everyone is willing to extend an additional 5 minutes, I'd really appreciate it. Okay, next question. How did you feel about your provider during your pregnancy and prenatal visits? Did you notice any red flags that may have foreshadowed your labor and birth experience? Gayle, we'll start with you.
So this is no shade or no judgment on like all military hospitals, but I gave birth in a military hospital. And so in those, you kind of see a rotation of people. Also, I had my first child 5 days before my 24th birthday. And so part of it was that I was naive and genuinely trusting that a medical degree made you the expert. But boy, I learned a lesson the next time. And so, even I have a healthy distrust of all medical professionals now. Even if I made like just and I say that because even when it comes to my children's doctors, the people hate to see me coming. When I gave birth to my daughter, a lady told me like, because I did ended up breastfeeding, but I was struggling because they had given her formula, and they lose weight, and she was like, if you can't be trusted with your baby, we could take her. And I'm from Memphis, y'all, and so is my mama. And I called my mama, and she was like, I'm 1,200 miles away from you. So no, you cannot just pop up at the hospital. But I very much had like the support from my family to say like, no, that lady's wrong. They can't take your baby. So now ever since then, it's really been up and stuck with any medical. I have a healthy distrust. So, but no red flags at first. But now all I see is red when I'm in the hospital.
Right. I can totally understand that. ZuShanna, anything for you? I know you changed providers, so.
Unfortunately, no, there were no red flags. I trusted each and every one of them when I hired them, and they showed themselves afterwards. Unfortunately, I had a similar experience postpartum with my VBAC with my son. Less than 24 hours later, a resident threatened to take my son because I wouldn't do what she wanted me to do, and said that there were studies supporting what she wanted to do, and the studies supported what I wanted to do, which was breastfeeding. And when I told her, you do not have my permission to run extra blood tests and XYZ with my son, I said, I'm his mother. She said, I'm his doctor. And she told my husband, I will call ACS. And unfortunately, I was 38, but I looked 18. And so she treated me like I didn't have any rights.
Mm.
So unfortunately, I too have a distrust.
Okay. LaTanya, any red flags during your prenatal visits?
I feel like the red flag is the energy connection. I feel like with anybody, like with personal, like in your personal life, you're able to kind of feel if the energy doesn't align, or if you feel like you're not understood, or like there's a communication barrier. And so I would say,
we lost her. Okay, she can finish if she pops back on. Michaela, any red flags?
I don't have any red flags with my provider, but unfortunately, because we had to use the vacuum for his birth, it was out of her hands. And so I had to go with the hospital OB. I had no issue with the actual OB that delivered him. I had problems with the nurses and the residents. And the nurses and residents, Wisconsin's so weird. So the nurses and residents here are connected to the university. Then OBs are on their own and are within clinics. And then my provider was private. And so it's just like, if it doesn't go to the plan, then all of us lose any type of free choice. So,
Gotcha.
I mean, I have red flags for the hospital, but not for my personal provider.
Okay, thank you. A couple more questions and then we can wrap this up. I'm so sorry for all of your experiences and thank you for sharing. Some of you mentioned having a birth doula. Did any of you have a postpartum doula? Gayle.
So actually, what's funny is after I had my daughter, I said, I realized like the need of a birth doula and a postpartum doula. And so what I did was I trained as a postpartum doula, but then I ended up pregnant. So I couldn't really do anything with it, but having that knowledge actually helped me train my husband and like help train my mama and my friends to kind of help them help me.
I like that strategy. ZuShanna.
No, unfortunately, I didn't. I did advocate for having a doula with each of my births, but I didn't even have the foresight to think of hiring a postpartum doula.
Okay, Michaela.
Sorry, it's nursing time. So.
Yeah.
Yes, I have the privilege that my doula is a full spectrum doula, so she was also my birth doula and my postpartum doula.
Wonderful. And final question comes from a mental health provider. What do you feel like is needed or missing in trauma-informed, cultural competent care? Gayle?
Education, fully informed education, kindness, to be quite honest. If you are not a kind person, you may know the material, but the closest I've ever come to death is when I was giving birth. And so that requires somebody to be delicate in understanding of what someone may be going through, especially as a Black woman. So kindness and just fully informed, leave no stone unturned when it comes to helping people make informed decisions.
Thank you, ZuShanna.
I would say listening, actually listening to the patient, trusting the patient. I know we need to wrap up, but it was always said that I had small veins, and it turns out my veins are actually just deep. And so with my second birth, I believe, the nurse realized it was deep and told me where it was so literally every surgery I've ever had, every procedure, I've had to like have blood taken from my hands in between my fingers. I had a PICC line put in that nobody knew how to use, all kinds of things. And with my second son, the nurse said, it's here and it's deep. 45-degree angle, go deep, XYZ. And so I would tell providers and providers wouldn't listen to me. And then when they wouldn't listen to me, they wouldn't find my vein. They would listen to me and they'd find my vein. Even with me being overweight, people assume I have high blood pressure, XYZ. I wasn't listened to. And it's when you listen to the patient, you can best treat them.
Thank you for that. Michaela, what do you think is missing from trauma-informed, culturally competent care?
To remember that even though we've had these experiences, we also have trauma from everyday racism, and to also put that in your care. You know, we might have a good day of not going through or dealing with grief of our birth trauma, but we may have a bad day dealing with someone who is racist. And so I think that anyone who is giving any type of care surrounding trauma informed, they also need to have that in the back of their brain.
Thank you so much. One just final comment and we can wrap up from Maternity Journey. Thank you for your responses. I find that a lot of women who don't see red flags or have high trust for their OB, and that changes suddenly towards the end of the pregnancy or during the labor and birth. I hate that you all experience this level of birth trauma, and I pray for your healing. So grateful you all shared your experiences. I couldn't echo that more. So thank you so much for that comment. Thank you, Gayle. Thank you, Michaela. Thank you, ZuShanna. And thank you, LaTanya. I know she probably got cut off, but I appreciate you all so much for the willingness to be vulnerable and transparent in this space. And I appreciate you guys so much for spending your evening with us. To the attendees, thank you so much for staying for the duration. I appreciate you all and have a good night.
Thank you. Have a wonderful night.
You too. Bye.
Bye.